Johannes, you're qualified as an acupuncturist now, yeah? You started training in Western medicine before. How have you found studying traditional Chinese medicine? How have you been able to, or even have you been able to put those two different systems together?
Some of them actually. In diagnosis it might sometimes help, and it also helps to understand when patients come with the Western labels, but on the other hand it can make your thinking overcomplicated. In some cases you sometimes miss the simple hints because it will just...
Okay. So when you were still studying Chinese medicine, did you find it easier because you knew Western medicine, or did you find that it kind of got in the way because your mind was thinking?
The longer I'm into Chinese medicine now, the more the Western medicine helps me. In the beginning, it was more in the way, but now it's getting connected a bit.
What do you think of the research that's being conducted into acupuncture and Chinese medicine at the moment? Do you look at much research? Do you have any opinion whether it's good or bad, or how it could be done differently?
Yeah, especially when we do our own assignments, or when we did our own assignments and dissertations. Of course, we need the research that is out there, and especially for the herbs as well, there's come very interesting research in acupuncture. When some points are proven, one day you see a picture that points of a system are proven that these points should prove the whole system.
Right.
So in the end, I think the treatment at the patient does not really need the research for that, but for the public view and for the confidence of the practitioners, I think it's very important.
I mean, one of the things I think is that the kind of way lots of research is conducted treating acupuncture almost like drugs. It's very different to the way that we as practitioners naturally practice, which is we see everyone as an individual, we treat what we see on that day. So it's a very complex intervention. We talk to the people, we palpate the person, and maybe under research circumstances that kind of interaction doesn't happen, and that might be a big part.
A lot is going lost in research for acupuncture. That makes it, and also the RCTs. It is more than just the needle.
So do you think there's a place for acupuncture and herbs in the modern kind of medical world? Do you think there's use for that?
Of course, because it is clinically very effective. It goes nearer to the patient. The patients love it, and they're getting better. And that's what should be what we should look at.
Do you see it being integrated into the health services of most Western developed countries?
Well, the one thing is when I see that doctors with a few weekends try to apply acupuncture to their patients, I'm normally really scared about that, because they're normally not knowing what they're doing with those short courses. Some of them then develop skills and can do that as well. That's a good thing, and led to acupuncturists to work in Western hospitals. Why not? I mean, if that can be implied, it would be a good thing, but I'm not seeing that at the moment really happening.
That would be the ideal outcome, wouldn't it? Would be to have the acupuncturists trained in traditional Chinese medicine working alongside people trained in kind of Western medicine. But I'm not quite sure if most health services or drugs companies would like to see that happen.
If we push into this direction, I think it will create more friction towards the people who don't appreciate our evidence. It's another point.
Thanks, Johannes.
Thanks.